I'm Emma Tiffin, and I'm a practicing GP and the Cambridgeshire and Peterborough CCG Adult Clinical Mental Health Lead. I'm also the National Advisor to NHS England Improvement for the Community Mental Health Transformation Programme. I wanted to make you aware that people with severe mental illness are in JCVI Priority Group 6 in order to receive the COVID vaccination, and therefore should now be receiving their invitation letters. We know that people living with severe mental illness experience some of the worst inequalities, with a life expectancy of up to 20 years less than the general population. And emerging research shows that due to their potential vulnerability, people with existing mental health conditions appear to be at greater risk of poorer outcomes of COVID-19 than the general population. It is therefore really important that we do everything we can to support people with SMI to access the vaccine. The Joint Committee for Vaccinations and Immunisations Guidance uses the Green Book definition for severe mental illness, which says individuals with schizophrenia or bipolar disorder or any mental illness that causes severe functional impairment. So we need to take a pragmatic and inclusive approach to vaccinating these groups based on clinical judgment. Due to the potential vulnerability of people with SMI, it is important that we do everything we can to make sure they get their COVID-19 vaccinations. And this includes proactively going through your practice register to make sure people with SMI know they are eligible for the vaccines and that they are taking up both vaccinations. Please also make your patients with SMI aware that they are entitled to reasonable adjustments, including, where possible, for example, appointment reminders, longer appointments, a contact to answer any questions or queries, and to address anxieties that people may have. It is also important to provide support and advice if people are scared of needles, such as listening to music or accessing a psychological intervention. And environmental conditions, such as a quiet space to wait, or a member of staff trained in mental health conditions, can make a big difference to a patient attending for vaccination. We must also think about providing a sign language or translation service where required, and allowing our patients to bring a carer, a friend, or a peer support worker to accompany them to their vaccination appointment for support. And some people with severe mental illness cannot leave their home to get to their appointment, or it may be too far for them to travel. So please do reach out to them and make sure they get their vaccination at home. Your clinical commissioning group, or CCG, has received dedicated funding to allow this to happen. And for more information, you can visit www.nhs.uk, or there is information for patients providing advice, support about the vaccine and severe mental illness at www.rethink.org. And there is also an Equally Well leaflet, which is very useful for supporting patients to access their COVID vaccine if they have a severe mental illness. Thank you.